Thank you for inviting me to speak to you today, and I'm sorry I cannot be with you in person. I was proud to help launch Labour's Mental Health Forum in the northwest of England, and I will continue to support and work with all of you. As a former arts professional working in mental health, I understand the value of a holistic approach to mental health and the importance of investment in social care and culture and art therapy. The question is, what can Labour do to reform mental health? As a mental health ambassador within the European Parliament, I can offer you some broad strokes from the perspective of a European strategy. I have co-authored a report on gender equality in mental health, which is due to be voted on by the European Parliament in February. The report outlines an ambitious European strategy on mental health and well-being, which we would like to see the European Commission and European governments implement. Despite the anti-European narrative in the right-wing press, the EU is an incredibly effective mechanism for bringing together different networks, experts and civil society organisations, and for sharing best practice across member states. Even after Brexit, regardless of what happens, we can and must engage with those networks and contacts. My team and I have been working especially closely with Mental Health Europe, the European network representing practitioners in the field, and you should find out about their work. We understand that mental health cannot be seen in isolation. In today's world, our environment, our workplace, and our economic and social situation all impact on our mental health and well-being. That's why, together with practitioners across Europe, we highlight the psychosocial, all-of-society approach to mental health that takes into account all aspects of a person's life holistically. The report that I co-authored emphasises the impact of austerity policies and public service cuts on the mental well-being of the most vulnerable people in society and the disproportionate effect on women and girls. If we ask, how can we reform mental health policy, then ending austerity is crucial. Labour must do all it can to fight that battle, not just for the NHS, but across all public services, as the key to our well-being lies in access to arts, libraries and informal education, and for young people, a decent youth service. As the economic impacts of Brexit begin to unfold, this battle will become more and more important. A holistic approach also means that we must promote education on mental health and well-being in order to break down the stigmas and taboos which surround the subject. Education on mental health should start at a young age and continue through formal, non-formal and informal education at all levels. All of us are living more and more of our lives online, and that especially applies to young people. We need, therefore, to discuss and assess how the online experience and social media impact our mental health, and we must include that in our policies. From my experience working across Europe, I see that it is important to tailor policies specifically for different groups of people with different vulnerabilities. A refugee woman living on the street with her children will have different mental health needs than a young university student who is experiencing depression and anxiety. They both need access to care and support that matches their needs. All these elements have a strong gender component to them. Women tend to face very different mental health trajectories over their lifetime than men, and LGBTI people tend to have specific vulnerabilities. But all people face mental health challenges because of gender stereotypes and discrimination, whether it's because society tells you you're too emotional as a woman, or if as a man you're told you're not allowed to express any emotion at all. So we need to overcome gender inequalities in mental health holistically, as in other parts of our lives. The arts and cultural activities are an incredibly effective vehicle for addressing mental well-being needs and for providing mental health care and support. This allows for social empowerment and inclusion of people who may otherwise feel marginalised. And it's an effective approach that I have witnessed throughout my career, and I would encourage you to promote. To find out more about what the EU has done on mental health, look up the EU Compass on Mental Health and the Joint Action for Mental Health and Wellbeing, which fosters cooperation and brings together stakeholders from across Europe. And you can find out more about my work at juliewardmep.eu and follow me on Twitter and Facebook at Julie4NW. Thank you for taking the time to listen, and have a great gathering.